Let me explain why this is true. Now, once you know the mechanism underlying cancer, it's all obvious why screening can't work and nor can treatment. Let's talk about the mechanism of cancer growth. And you can read about this. You want to read a 40-page report on it, it's right here. It's 40 pages, 15 pages. Anyway, cells live in a neighborly manner, and they're not allowed to divide anytime they want. If they're divided anytime they want at their own free will, we become misshapen masses in a matter of days. So cells are allowed to divide under certain circumstances, like if there's a stimulus for growth from a brain signal or hormone signal, then we're allowed to grow. If a cell gets injured, like we get a laceration, then the cells next to that injury can proliferate, can grow, and repair the injury. That's fair. That's what's allowed to be done. And we have these regulatory mechanisms that make sure this works correctly and properly, so we stay in the form that we are. Well, cells get injured, and they get injured by things like radiation and products of cigarette smoke, combustion, and various toxins in our environment. And as a consequence of injury, when it's serious, most cells die. But sometimes cells die, or cells get injured, not bad enough to die, but bad enough to stop being neighborly. And then they start dividing at their own free will, and that's, of course, the transition from normal to cancer. And one cell always leads the way in the breast or the prostate. One cell always leads the way. So let's take that cell. The first cell begins, and the doubling time, on average, the doubling time is every 100 days for a solid tumor, be it breast, colon, prostate, or lung. It's every 100 days. So 100 days later, you have 2 cancer cells. 3.5 months later, you have 4. And now you have had a cancer for a year, and you've got 8 to 12 cells lurking in a breast that contains 100 billion cells per breast, and a prostate that contains 100 billion cells. Of course, obviously undetectable. Divisions continue. You go to 16, 32, 64. You've had cancer for a year, and you have less than 100 cells in your tumor mass. You couldn't possibly find it. At these early stages, if it's truly cancer, then it starts to metastasize, and the tissues it goes to, it has a similar doubling rate to the original tumor. And of course, it's the metastases that kill. It's not the original tumor. No one dies of breast cancer or prostate cancer. They die of metastases to the lungs, bone, brain, etc. Well, the divisions continue, and finally you reach a tumor mass after 6 years on average that contains 1 million cells. It's the size of a period on a paper, a lead tip. It's undetectable by any current means, yet it has been growing 6 years. It has amassed 1 million cells. If it is truly cancer, it is spread over 90% of the time, and probably 100% of the time. If it's truly cancer, there are lots of things that we treat that we tell the patients it's cancer, and it's really not cancer. Anyway, so the divisions continue, and finally you get to a detectable tumor mass. It's 1 billion cells in size. It's a centimeter, the size of a eraser of a pencil. At this size, the tumor now is able to increase the PSA level. Prostate specific antigen increases only after the mass is a centimeter in size. In other words, it's been growing an average of 10 years, and it contains 1 billion cells. It's the size that you can feel on digital rectal examination or breast self-examination. You may pick up a tumor mass 6 to 2 years earlier on mammography, but the truth is because of the kinds of tumor masses that are picked up on mammography, the average length of doubling is about 14 years before you find them. 2/3 of the disease has occurred without the knowledge of the patient or the doctor. It has already expressed itself. In more crude terms, the cattle are already out of the barn before the door is closed. And that's the truth. And every oncologist and every doctor should know that. That's the natural history of this disease. So how in the world are you going to take and treat a disease that's already expressed itself with local treatments like surgery and radiation? It's impossible. That's why they don't survive any longer. It'd be nice if we had chemotherapy agents that worked. It really would be. But by and large, the chemotherapy agents are ineffective, and I gave you some exceptions, and they're very toxic. Of course, that's why chemotherapy is so popular, is because everybody realizes this natural history. And local therapy does not treat systemic disease. It can't possibly do it. It'll never work. It'll never work. But we continue to do it. You know, even after these kinds of realizations, and even after the effort to change from more radical to more conservative therapy in terms of prostate cancer, in terms of breast cancer, you know, still these days, 65% of women get mastectomies. And we've had laws of informed consent in 18 states as long ago as 30 years ago. And yet, 65% of women get mastectomies. Okay. Oh, by the way, this doubling time is on average every 100 days, but some women double their tumors every 24 days. Some women double their tumors every 850 days. I believe you can change that doubling time with a change in diet. I did and published the first scientific study on the dietary treatment of breast cancer in about 1982. Since then, there have been about 20 studies published in our best medical journals on the dietary treatment of breast cancer and other cancers. And everything says you can slow that doubling time. And so our goal should be to slow the doubling time, so instead of a woman dying in 3 years, she dies in 12 years. Or maybe our goal should be to have all of our patients with prostate and breast cancer die of their disease when they're 95. We're certainly not accomplishing that with present methods.